So what we're going to do is, who do we have here? What's your name?
David Duppa.
David. Okay, David. And we have Dad over here. And we're going to make a little video here to show some nice things here. Okay? So, guys, is it okay? Do you mind being movie stars? Can we film this and can we put it on the website? And here's Lisa. She's going to be handling the camera for a minute. And so now I'm going to hand this over to Lisa. Okay? All right. So here's the situation. David's got a little cavity in there. Okay? And we all know the kind of things that kids don't like. Okay? So how old are you, David?
I'm 4.
4. Okay. So everyone's concerned how David's going to do with this cavity, and it's going to be so simple, it's unbelievable. So what I'm going to do is, first of all, we're going to take this little container. I just took the top off. This is silver diamine fluoride. Silver diamine fluoride, sometimes called SDF, just for short. And yeah, David's got a paintbrush too, because we were just showing him what we're going to do. And here's how we're going to treat this cavity. Okay? So the first thing we're going to do, can you open real big, David? And I'm going to put a little air in here. And I don't know, Lisa, can you see that cavity in there? Is that possible, just to get that little? Can you just see that? Just to get a view of it. Okay, see, I'm pointing to it right here. That's a little dark spot. Okay, now you can back up. And here's what we're going to do. I'm going to take the paintbrush. Can you see this?
Yes.
I'm dipping it in the SDF, silver diamine fluoride. Now watch what I'm going to do. I told David ahead of time, we're just going to put this paintbrush right here. Okay? And I'm going to just take another little bit just to make sure. I'm going to put it right here. Open real big, buddy. Can you open real big? There you go. There you go. And we're just going to put this in here. And I'm going to time this for about 1 minute. Now, Lisa, you've got a little timer on there, right? You see where it says?
Yes.
Okay. So I want you to tell me when one minute is up, okay?
Yep.
All right. So we're putting this in there. David's doing pretty good. We had it in there for about maybe 20, 30 seconds now. Okay. Let's give it about another 30 seconds. Oops, almost done. Almost done. Getting tired of that? You getting tired of that? No? Okay.
Just relax. Almost done.
Almost done. Open a little bit bigger, just a little bit.
Open up.
A little bit.
Open your mouth.
Got that right in there. Good deal. Just about there?
Almost, not quite.
Okay.
We're getting there.
Almost, huh?
Mm-hmm.
1 minute. Pretty simple.
Yep. A couple seconds
Is
left.
that about it? All right, I think we're pretty close.
Yep.
Now what I'm going to do is I'm just going to take a little cotton. I'm just going to dab this right here. Can you open on that?
Open.
There you go, buddy. You take that. Oops, one more time.
Open.
There you go. Okay, you want to sit up now, David? And I'm going to have you rinse out, okay? Here you are. Here's some water. Whoop.
Get him a different cup then.
Yeah, I'll get him a different cup here. Can you just grab me one? That's our glitch for the morning here. Here you go. And David's rinsing out on that. Now, what I just want to tell you,
Spit it here.
and you can focus on me now if you want, and I'll get my
Oh, thank you.
geeky glasses off here. Silver diamine fluoride, or SDF, has been used
You need more?
in Europe for quite a number of years as a desensitizing agent. And it's also been used to arrest decay. It doesn't cure decay, it's not a filling, but it'll arrest decay, it stops it. So what we were able to do today is to avoid a couple of things. The dreaded SHOT, the numb feeling that's left afterwards, and we also do not have to worry about one other thing, and that is sometimes when the kids leave here, they're biting their cheek because they have all this numbness. And of course, we didn't have to use the DRILL. Okay, so no shots, no numbness, no drill. So this material will go in there, and what's going to happen is it hardens the decay. So as we say, it arrests it, it stops it. Now, does it work every single time? It works the absolute vast majority of the time. If it does not totally work, you find out in about a week, because what's going to happen in about a week, when we see this again, is we're going to see that sort of brownish color that was the decay. It's going to turn sort of a blackish silver color. And that's good, because it means it's working. And when we go in there and we touch it with our little explorer, little shepherd's hook pick, as people call it, that material is going to cause the decay to actually harden. It'll get very, very hard. So we've got something in there that kills the decay, it kills the bacteria that's in the decay, it hardens the decay, and it stops it. If we didn't have enough in there, if it's not totally working, what's going to happen is we will not have a total black color, and when I touch the decay, it'll be a little on the soft side. What do we do then? Dad wants to know. We put another drop on there for another minute, okay? And then people say, well, do we do this for all teeth? No, we don't usually do it for permanent teeth, but we like using it on primary teeth, especially on younger kids, because what's going to happen is this effect usually will last at least 6 to 12 months. But my buddy here is going to be in here in 6 months getting his teeth cleaned. So if we see that it's still hard, we're good. If it's getting a little soft and we need another application, we'll put another application in. And the idea is that on a primary tooth like this, that is going to keep that tooth and keep it intact, no pain, no progression of the decay, and we didn't have to traumatize this young person. So what will happen is that eventually when that baby tooth falls out, we should not have had any other sort of incidents in terms of him having any problems or anything like that. So as you can see, he's having a good time. And anyone who's worked on kids, whether you're a pediatrician or a dentist, it could be a lot worse. So he's coming here. How'd you do, buddy?
Good.
You did okay? Was that okay for you? What do you think of silver diamine fluoride? Is it pretty good stuff? Yeah? Okay, that's what I thought. All right, another video will come and we'll take it from there.